Good afternoon, everyone. My name is Adrienne Prettyman, student nurse practitioner of Herzing University, class NU 673, 7C, Psychiatric Mental Health Care. Today I am presenting my substance use project or presentation on marijuana. Marijuana is locally known and referred to using several names such as pot, dope, and weed. It is mostly accessed in the form of dried stems, leaves, seeds, and flowers of the cannabis plant. The plant has several active compounds, including tetrahydrocannabinol, THC, which impairs the mind and alters normal body functioning. Marijuana can be consumed in various ways. First, it can be vaped using specific devices such as a vape pen. Secondly, it can be mixed in drinks and foods such as cake, tea, alcohol, and cookies. Finally, it can be smoked similarly to the way cigarettes are ingested. Marijuana is known to hold significant effects on a person that could either be positive, such as a drastic improvement in activity, or negative, such as a loss of cognition, especially when abused over a long term. Several factors determine how marijuana will affect a person. These include the amount of the drug consumed, the frequency of usage, an individual's biological characteristics such as their DNA or genes, and sex, where women experience more dizziness after using the drug than men. The history of abuse. The United States has a long history of marijuana rate of usage. Originally, the cannabis plant was used as a raw material in the textile industry, later gaining attention as a medicinal component. However, the plant became controversial throughout the years due to its effects on people who consumed it. Between 1900 to 1930, marijuana was widely used as a medicinal component due to its analgesic properties. It was used as a sedative and in treating muscle spasms during this period. However, Mexican immigrants introduced a new concept in the U.S. where marijuana started being used for recreation. In the 1930s, research began to link marijuana use to violence and criminal acts and aggressive campaigns to criminalize. Marijuana was started with the claim that it made people go insane. In the 1960s, marijuana became popular among young college students who abused it and fought laws prohibiting its usage. Up to 1999, American presidents, including George Bush and Bill Clinton, fought marijuana usage and invested in television campaigns against marijuana and other drug usage. Prevalence and epidemiology in the United States. Currently, marijuana is the most commonly used and abused illegal drug in the United States. Among people over 12 years of age, approximately 49.6 million, which is 17.9%, reporting having used a drug in the past 12 months. Research shows that in every 10 people, approximately 3 who use marijuana have cannabis use disorder. The risk of getting CUD is higher for people who use the drug before 18. Marijuana is known to significantly affect the brain, especially the sections of the brain that coordinate memory, attention, decision-making, emotion, and coordination. Children and teens are at a higher risk of the adverse effects of marijuana usage. Long-term drug use or frequent use is associated with an elevated risk of schizophrenia or psychosis. Additionally, when marijuana is used during pregnancy, it elevates the person's risk of complications. Risk factors or vulnerable populations. Anyone can be associated with the use of marijuana. However, some factors increase the likelihood and possibility of abusing the drug. These include the presence of a mental health disorder such as depression. A person who is not in their right state of mind is more likely to abuse marijuana than one who does not have a mental disorder. Another risk factor is a family history of marijuana abuse. It is common to find specific families known for marijuana abuse throughout several generations. The increased risk could be due to genetic exposure or observational learning that occurs between children and adults. Another coherent risk factor is the early use of marijuana, which alters the brain's functioning and places one at an increased risk of abusing the drug. Other risk factors include the absence of family bonds and parental involvement, the use of other highly addictive drugs, and peer pressure. Short and long-term side effects of marijuana usage. When marijuana is taken, THC rapidly enters the bloodstream and is carried throughout the body, including the brain. Short-term effects are felt almost immediately, and most people experience a calming sense of relaxation and euphoria. While these effects are positive, some people experience negative effects, including panic, short-term memory lapse, hallucinations, and a forgotten sense of identity. Long-term effects of marijuana usage are scarier and usually start to show after several months of taking the drug. These effects include poor performance and schoolwork, decreased satisfaction with life, antisocial behavior, financial problems, and a massive decline in IQ. The effects are worse if marijuana use starts early, such as adolescence. Signs and symptoms of marijuana abuse upon assessment. There are several signs and symptoms of marijuana abuse that can be easily seen from an individual's lifestyle and state of health. However, some require a thorough medical and psychological assessment to be identified. These include having decreased coordination upon a closer look at the individual. They may seem alright from the outside, but one step closer to them, one may realize that they lack coordination in their life. Other signs include an increased appetite, rapid weight gain, paranoia, decreased motivation, distorted judgment, perception, and sleepiness. All these signs and symptoms can be realized once a thorough psychological and clinical assessment is done. Despite the drug's negative effect, an individual cannot discontinue or reduce marijuana usage. Potential for overdose. Marijuana overdose does not directly cause death. However, high doses of the drug can cause adverse health effects such as lung problems and weight gain that predispose one to chronic illnesses such as diabetes and hypertension, memory loss, hallucinations, and lack of coordination. For instance, when one hits the road after taking THC overdose, they are likely to experience confusion and lack of coordination, which might eventually result in a fatal road accident. These adverse health effects can indirectly lead to death, making marijuana overdose a suicide weapon of choice. Care plan for a patient with CUD, which includes pharmacological treatment. Currently, no Food and Drug Administration approved medications can be used to treat CUD. However, some symptoms of CUD, such as disordered sleeping patterns, can be managed using medications that facilitate sleep. Some of these medications include zolpidem, buspirone, and Neurontin. These drugs have shown massive promise in their early studies and clinical trials. They will aid in improving sleep and function in the patient. Non-pharmacological treatments such as behavioral approaches will include cognitive behavior therapy to help the patient identify and correct ill behaviors and gradually enhance their ability to stop drug usage. Other behavioral approaches include contingency management and motivational enhancement therapy. Patient education will include the patient will be educated on short and long-term effects of marijuana abuse, risk factors and vulnerability, ways to manage the situation through gradual progress. Referral. The patient will be referred for further consultation with psychologists overseeing the other diagnostic procedures. Follow-up will be done once every week to ensure the patient follows all pharmacological and non-pharmacological management addressed in the care setting. Positive reinforcement will be done after every successful effort, while more education and encouragement will be given after every unsuccessful effort. Conclusion. Originally, marijuana was only known for its versatility and benefits, including being used in the textile industry. As time passed, it gained attention as a medical component and later as a recreational drug. Over the years, marijuana has attracted massive criticism due to its adverse effects on health and well-being, especially when taken over a long term. Currently, it is the most commonly used illegal drug in the United States. Risk factors towards marijuana abuse include a mental health disorder, family history of marijuana usage, and early use of marijuana. Marijuana significantly impairs the normal function of the brain and the entire body. Short-term effects of the drug include euphoria and relaxation, panic, memory lapse, hallucinations, and a forgotten identity sense. Long-term effects include antisocial behavior, deep financial problems, and decreased satisfaction with life. A marijuana overdose is likely to cause adverse health effects that may lead to death. Current treatment options for CUD include both pharmacological and non-pharmacological approaches. And that concludes my presentation on substance use marijuana. Thank you and have a great one.